This video will cover mast cells and their role in our immune system, so stay tuned. Hi, I'm Erin Kolb. I'm a family nurse practitioner specializing in allergy and immunology with expertise in mast cell disease. I'm here to provide insights and information, both as a medical provider and as someone who's personally living with mast cell activation syndrome. Please remember that this is for educational purposes only and doesn't replace your own personalized care from a healthcare provider. So, what are mast cells? Well, they're white blood cells that are found throughout our body in almost every tissue. And most of you think of them probably with allergies and the release of histamine. So when you have a dust mite allergy, or when that ragweed pollen is really bothering you, giving you itchy eyes or runny nose, they do so much more for our body. They are involved in every stage of wound healing, and that's important. They help us fight parasites, and they also are involved in inflammation. Acute inflammation can be a good thing because that lets us know that something's wrong in our body and we need to address it. But chronic inflammation is not such a good thing. And other types of white blood cells that you might have heard of are basophils, eosinophils, lymphocytes. And those you can see on a lab count. Like when you get your blood drawn, those types of white blood cells will show up, but not mast cells, because mast cells in their mature form are out in the tissues. They're not hanging out in the blood for us to measure in that way. So mast cells have packets of granules in them. Think of inside the cell lots of balloons filled with marbles. And these marbles, these granules, are mast cell mediators. They're the chemicals that get released during some type of reaction or stimulation or activation of this mast cell. They get released and they send the messages to other cells in our body to make something happen. So some of these chemicals in these packets are histamine and tryptase. Also, we have heparin, we've got prostaglandins, leukotrienes, and other cytokines and interleukin. That immediate explosion of spilling the chemicals, spilling those granules is called degranulation. So, what kind of symptoms can be experienced when mast cells are activated? Well, since mast cells are throughout the whole body, we can experience symptoms in every system, really. But mostly, we think about itchy eyes, watery eyes, runny nose, nasal congestion, postnasal drip, having to clear our throat a lot like that, sneezing, coughing, or ear fullness or ear pain. Other things that are pretty common are hives. So that bump on our skin that can be like a mosquito bite and raised, red, itchy. And that is caused by mast cells releasing histamine right there in the skin. And then some people with allergies can feel headaches and tiredness from their allergies, or stomach aches, or even diarrhea, or have trouble breathing. And somebody also has asthma, that can trigger asthma to be worsened. And then some people could have a more widespread anaphylactic reaction to an allergen, such as somebody who's allergic to peanuts, or even a bee sting. So venom allergy sometimes is just a local reaction, local pain and inflammation and swelling, or for somebody who is very severely allergic to bees, they could have anaphylaxis. So anaphylaxis is a severe, life-threatening allergic reaction. It's when somebody is exposed to something they're allergic to, and their immune system and mast cells release a flood of chemicals that affect so many things in the body. And when somebody is having anaphylaxis, they need to use an epinephrine autoinjector and be treated immediately because anaphylaxis can be deadly. So, possible triggers of mast cell activation. Environmental allergies, like we talked about, such as dust allergy or tree pollen allergy. But other things can trigger mast cells, especially in those who are very sensitive and have a mast cell disorder, such as systemic mastocytosis or mast cell activation syndrome. Things that could trigger mast cell degranulation could be alcohol, sunlight, heat, cold, exercise. Stress is a big one. Sometimes airborne fragrances, chemicals, or odors. and sometimes foods. Okay, so like I said, our mast cells are part of our immune system that do some good things for us, protect us from parasites, help in every stage of wound healing, but they also can cause some problems for us and some symptoms of itching and runny nose and worse because mast cells are found throughout the entire body. Thank you for watching this video. If you found it helpful, please give it a thumbs up and send it to others who you think might benefit. And I'd love to know what other topics you would like me to cover. So please feel free to leave those in the comments below. And thank you again for watching Mast Cell Care. See you in the next video.